Respected Chair, learned audience, greetings from Bangladesh and good morning. This is Professor Dr. Mozibur Rahman. Just I am presenting basic protocol-based intervention in neonatal care and training can reduce the neonatal mortality. According to WHO report, we know that globally 2.3 million newborns die annually. Neonatal death accounts for nearly half of the under 5 death. In Southeast Asia region, Bangladesh occupies its 4th position, but it should be more better position. We are decreasing our neonatal mortality rate day by day. Still it is high, but we are trying to reduce this. Neonatal mortality rate Bangladesh trends and targets. Once upon a time, in 1993, it was 53 per thousand live birth. Now it is near about 18 to 20, and our target is 12 per thousand live birth in 2030. I think that we will be able to achieve this within this time. Why neonatal mortality rate matters? Early neonatal care determines the lifelong survival and health outcome. Neonatal death contributes about 65% of the total under 5 death in Bangladesh. In Bangladesh, prematurity, parental asphyxia, sepsis, and congenital birth defects are the major cause of the neonatal mortality. We are fighting against this. These are the causes of neonatal mortality, basic neonatal, major neonatal mortality causes in Bangladesh. We have some challenges: rural-urban inequities, weak referral systems, limited equipments, and inconsistent training and monitoring. But we are trying to overcome these issues. Bangladesh started its policy, that is sector-wide approach program and maternal health voucher scheme to emergency obstetric and neonatal care. Bangladesh has built a multi-sectoral approach integrating maternal and newborn health. And Bangladesh has achieved some targets, and Bangladesh has taken some programs to improve the neonatal health in Bangladesh. Like that, in just after independence, that is 1975, Bangladesh adopted the family planning policy. Then Bangladesh already, you know that the Bangladesh already have the free higher secondary, even graduate teaching for the female students are free of cost. And we have so many programs, just like IMCI. And lastly, we have taken the program for National Newborn Health Program. There is a plethora in maternal newborn health intervention along with the null health intervention also. Like we have the antenatal corticosteroid therapy for pregnant mother who are immediate to delivery, the preterm delivery. Cross-sectoral gains, education, women's empowerment, electrifications and economics, growth support systems already improved. You know that Bangladesh is a country of heroes. This year, we already crossed the low-income countries to middle-income countries, and July 1st is the historic day for Bangladesh that we are now in the middle-income country. Facility deliveries rose sharply. Now, majority occurs in private or government facilities. Positive trends in facility deliveries with increase from 51% to 2017 to 65% now. Training expansion, scaling up of the community-based skill birth attendance and training programs improve frontline competency. We have already trained about 10,000 healthcare providers for about the basic Introduction of the SCANOs and improvement outcome for the preterm and critical newborn infants across the districts. We have now 65 SCANOs and ICUs and government level at district level. These SCANOs and ICUs support the critically ill babies at district levels, and there is also some SCANO and ICUs in tertiary level also. Protocol-based approach, protocol standardized the evidence-based care across all the newborns. They minimize the variation, improve safety, and ensure timely detection of the complications. WHO Every Newborn Action Plan and Bangladesh NNSP, that is the National Newborn Health Program, we have a dramatic change in the neonatal mortality rate change. Delivery room protocol, we are following the delivery room protocol and a clean birth service and immediate drying, a delayed cord clamping, skin-to-skin contact with warm. Now we are thinking about the immediate kangaroo mother care. Highly essential newborn care is also included in Bangladesh, and this reduces the sepsis and also reduces the hypothermia. Kangaroo mother care, that is the skin-to-skin contact and exclusive breastfeeding for preterm infants, and it reduces the neonatal mortality by 36%. Now we have been adopted our ICMH, that is immediate kangaroo mother care just after birth, and immediate skin-to-skin care is the necessary for all preterm babies in Bangladesh. Infection protocols, we are following the septic protocol, and every NICU system has the specific protocol to control the specific infections, also the infection protocols. Helping Babies Breathe program, we have already trained about 25,000 healthcare providers, and our senior teacher and Wali Carlo, he is present here, and once upon a time he was in Bangladesh, and he observed this tremendous improvement in helping babies breathe in areas. Antenatal corticosteroids, dexamethasone for the mother in preterm labor, that is 24 to 34 weeks. You know that Bangladesh is a part of this WHO study, this Action Trial Study 1, Action Trial Study 3. I am the part of these two studies in Bangladesh, and my center, the Institute of Child and Mother Health, is one of the institute and one of the center in Bangladesh. Bangladesh having, including the 6 centers, but one of center is my institute, and I am the proud co-investigator of this study also. Life-saved tools evidence, this also heavily covers, and we have found that 70% of the preventable neonatal deaths averted through the childbirth and immediate newborn interventions. And Bangladesh projected to meet the SDG goal by 90% coverage within 2030. We found that 5,97,000 neonatal lives saved through this intervention. Quality of care focus. Protocols must be paired with the consistent supervision, audit, and mentorship for sustained improvement in Bangladesh. Community improvement and empowerment. We have already empowered all the manpower to reduce the neonatal mortality rate in Bangladesh. Global lesson. Bangladesh demonstrated that the low-cost protocol-based interventions can yield world-class outcome that we have already shown. Digital monitoring system, yes. Now we are sharing our data to our central monitoring systems, the Director General of Health Services. We have DSI Institute data. Here we have the data from the government and some non-government private hospital also. That is one of these is the Bangladesh Neonatal Hospital, community-based. It is the largest NICU-based hospital in Bangladesh. Yes, we have protocols and systems for the lucky babies, those who have the mothers and who can get their milk just after birth. But what protocol and what extra need for the unlucky babies, those who don't have mother or those who are abandoned? We are in challenge, but we are thinking about that, and we have taken some measures to the health outcome for the motherless babies also. This is about the motherless and abandoned newborn babies. These are the critical babies that was abandoned and that was found in different parts of Bangladesh. Extra protocol needed for the motherless and abandoned babies are that number one is the nutrition. They don't have mother. How can get this mother milk? For the survival of these babies, they need mother's milk. So we have just started our human milk bank. They need shelter. We have already installed it. We have the newborn hub. And we have to give the legal support for them, and we have some protocols to provide them legal support. Milk bank concept in Muslim countries is different from the Western countries because in Islamist there is some religious barrier that multiple donor milk mixer is not possible. So single donor and single mother is needed for them. A religiously combined human milk bank ensure this, yes. This project is to provide the breast milk to the critically ill newborn babies where there is no alternative to save their life without breast milk. Yes, basically this acts as a wet nurse also. We have all the infrastructures and all the instruments we have already installed, yes. These are the instruments needed for the special. There is a special pasteurizer, that is, we can just pasteurize the 5 ml milk even in the single container. That will carry an important role in Bangladesh. Yes, we have achieved this unbelievable dream in a Muslim country like Bangladesh by crossing through different levels of hurdles. Yes, over the last 10 years, we have rescued the 50s motherless abandoned babies and from different parts, and we have already saved them, and we have provided breast milk to them, and we have arranged the adoption according to the legal law of Bangladesh. This is the newborn hub where nurses and other staffs are trained to take care of these babies when their mother is absent, and they are providing the care for just instead of mother, and all the staffs are like loving mother. Legal help, yes. We are providing these babies to the loving families according to the law of the country. Just a simple video.
We were born without mothers, abandoned on the streets, fighting for life. Fragile and helpless, a mother's milk is our only hope to survive. Your protocols are for the fortunate babies who have a mother to feed them breast milk. But what about us? Will we never get that love? Will we never get another chance at life? Will the world not take responsibility for us? Through the milk given by the Human Milk Bank, we dream of a new beginning, to rise again, to live, and to one day become the strength and pride of our nation.
That is our future direction. Enhance the facility readiness, invest in the continuous training, strengthening data systems, and scale up for KMC. There is a protocol and training that is equal to the saved life, and quality, equity, and accountability drive the progress for the neonatal to reduce the neonatal mortality. Yes, it is the neonatal to reduce the neonatal mortality. Thank you all.